Okay, fantastic. Also, so everyone knows we will reserve some time at the end of today's webinar for Q&A. So just put those questions in the Q&A space at the bottom of your screen today. And lastly, we're going to attempt to run a quick poll to get an idea of what various fields and perspectives folks are coming here today from. So we can, we'll launch that poll right quick. That should work. I want to just try launching it. Okay, so do you guys see it there? Okay, great. So just fill in what areas you're coming from. We have nearly 80 people at this moment signed on, so it'll be good to know for the panelists as well where folks are coming from. So happy Friday, everybody. Midday, we're almost there to the weekend, and we are so grateful you are spending time with us here today. I know many of you in attendance and am just sincerely appreciate all of you showing up. And I hope this is the beginning of a fierce cross-sector and stakeholder advocacy to do better by Wisconsin's youth. So I would like to welcome you to the webinar. It's the impact of COVID-19 on the youth justice system, hosted by Youth Justice Wisconsin, which is an initiative housed at Kids Forward and is in partnership with Youth Justice Milwaukee. So with that, I am going to end the poll, and it looks like we have a lot of folks in the system, advocates coming from the school, a lot of community-based organization folks. So welcome. We're really excited to have you here for the conversation today. So thank you. I'm going to close that. Now, I'll introduce myself right quick. I am Erica Nelson, Advocacy Director for Kids Forward, and co-collaborator, co-conspirator with Ann McCullough, who is the Youth Justice Wisconsin consultant, as well as Sharlen Moore, who's a youth justice reform champion and director of Urban Underground. As Youth Justice Wisconsin and Kids Forward are the hosts of this webinar, we would like to acknowledge that we are residing on the ancestral land of the Ho-Chunk, land of which they were forcibly removed. And the broad-reaching impact of that colonization is still evident today, as is evidenced by the data that we presented in our report, and that shows that persistent disparities continue to exist in arrest for Native American youth. And it is our hope that by continuing to have these discussions and bringing forth the need for transformative reform of the system, that we can begin to mitigate the system all too often disproportionately creates. I'm also hopeful about what this report at its core tries to convey. That is that change is possible. Change is possible, and that it can be done quickly without long, arduous debate or pushback, but rather when the urgency of the moment requires acting differently. It is possible to do so and have improved outcomes. Now the question becomes, what next? This webinar is a discussion about just that. So let's get started. Ann McCullough will provide a brief overview of the report and its findings, and then we will kick it back out to our panelists who collectively represent many of the players involved in making change and implementing it. Let me quickly introduce our panelists. And this will be the same order that folks will be answering the questions later on. So raise your hand as your name is called. Bridget Todd Robbins, Youth Justice System of Care Administrator for Early Intervention of La Crosse County. One of our colleagues, Philip Stegemann, was also going to be here from La Crosse, but he's feeling a little under the weather, so we wish him well. Alana Peck is Youth Justice Policy Coordinator at Wisconsin's Department of Children and Families. Lance Horozewski, Assistant Administrator, Wisconsin Division of Juvenile Corrections. Sharlen Moore, Youth Justice Milwaukee and Urban Underground advocate, longstanding advocate for the closing of Lincoln Hills and Copper Lake. Genevieve Caffrey, UW Robert Lafollette School of Public Affairs and School of Social Work. And last but not least, our national colleague, Joshua Rovner, Senior Advocacy Associate at the Sentencing Project. So we will come back to these fabulous panelists shortly with some big questions. But for the moment, I'm going to hand it over to Anne.
Mm-hmm. Can you hear me?
Yep.
Okay. I think, all right, let me just. Okay. Why? I'm so sorry. Where is my, let's go back. Try this again. Oh. All right, everyone, let's try it again.
There we go.
All right, can you see my screen now?
Yes.
All right, thank you so much. Sorry about that. So this project began as a 6-month look at the impact of pandemic prevention protocols on the use of secure custody. It turned into a 2-year project with 3 different phases. As you might recall, after the immediate onset of the pandemic and the lockdown, quote unquote, there were headlines around, a sharp decline in the number of youth that were incarcerated across the country. We wanted to do a study to check in with Wisconsin stakeholders and see if we were mirroring the same trend. And so that's what we did in 2020. We looked at referrals to youth justice intake and average daily population data comparing between 2019 and 2021. And to find that pandemic protocols were being utilized and it was resulting in some changes across the system. Those findings led to 2 other areas of study. Over the course of the project, this state map in orange identifies the counties that participated. Everything was voluntary. It also identifies the tribal communities that participated through a focus session, a focus group with Indian Child Welfare Liaisons through Department of Children and Families, as well as 6 state agencies. I would say that the biggest asset that we had was the funding from the Governor's Juvenile Justice Council, as this study was under the objective of deinstitutionalization of youth from secure facilities, and then also incredibly strong partnerships and a very high level of collaboration and high level of interest. We couldn't have done it without that. Our timeline was very short, which limited the kind of data that we could collect and analyze. And it also, our project team, which was largely myself full-time and some part-time assistance from Erica and a data person, also provided some constraints. So the first area that we looked at, as we said, was the referrals to youth justice intake. And the big surprise was that there was a 65% decline in referrals to youth justice intake between 2019 and 2020. This was a finding that no one expected and no one had been tracking because all the focus had been on the population, average daily population within secure facilities. So while there were fewer youth in facilities, it wasn't because they were being turned away at higher levels, it was because they weren't being referred in the first place. And so there was a high level of interest to look at that and see how that happened and what it looked like statistically, as well as qualitatively in terms of survey responses. So our first area of, the first phase of the project did involve a survey from that was put out through youth justice stakeholder networks across Wisconsin. And the results of those surveys indicated that all youth justice stakeholders were seeing a decline in referrals. They didn't know to what extent, and everyone was surprised at how significant that was. So the next question we asked was, what were the referral disparities across racial groups? So we know that there are serious racial disparities among the youth that are involved in the youth justice system. We didn't know if a significantly restricted use of secure custody would change those disparity rates. Unfortunately, they didn't. So while there was a decrease in the number of youth or the number of referrals to youth justice intake across the state and across all racial groups, the disparity rates remain the same. So that being an Indigenous youth is 5 times more likely to be referred to youth justice intake than the white peers, and a Black youth is 3 times more likely to be referred. So then we went back in a second round and looked at youth arrests to see if the decline in youth arrests was similar to the decline in youth referrals. And what we found is that the maroon bars are the arrest data. There was a 36% decline between 2019 and 2020. But interestingly was the green bars represent the referrals, and there's still a much higher number of youth arrests than youth referrals. And so we went back and dug into that a little bit. In terms of looking at racial disparities, again, knowing that, well, first of all, that brought up the issue of deferring away from intake referral, which reduces the likelihood of a youth being detained. And both years, there were 50% of the arrests were diverted from intake. So that raises, kind of falls into the umbrella of diversion and continuing conversation around that. The question being, if there's a decline in arrests, then maybe the what rises to the level of arrest changed between 2019 and 2020, given the conditions. But if an arrest occurs, why wouldn't it be referred to? And maybe those arrests are a default for something else that would be more effective and more responsive to the needs at hand. Looking into the racial disparities, which we know are pre-existing, it was similar to referral rates where the disparity rates did not change, but the overall number of arrests did go down. So remaining that a Black youth is 3 times more likely to be arrested than the white peers, or 2 times more likely to be arrested for an Indigenous youth, and that the rate of arrest for white and Asian American youth are lower than the general youth population arrest rate altogether. A note on the data that we looked at did not consistently disaggregate for ethnicity, and so we had a lot of missing data components for Latino and Latino youth, and that's why they're not that racial group is not reflected in this study. So in terms of system impact, that's we just finished the quantitative look, and now the qualitative responses fell into several themes, and kind of around the question of what did you do to avoid the use of secure custody since it wasn't as widely available, and what do you think was happening to account for the decline in youth arrests? And so the responses were, surprising in the fact that most of the changes and adaptation to the lack of secure custody as an option came through collaboration, increased collaboration, new partnerships, more sophisticated or stronger partnerships, increased communication with stakeholders and partners in order to divert cases and to be more responsive to youth in the community. So for example, one participant said, I believe there was a collaborative effort by law enforcement, social workers, judges, and detention facilities to only use secure detention when community safety was at risk. And that came from a detention supervisor from their observation. There was also an increased consideration of mental health issues, and so having more resources directed towards mental health needs and crisis response. So one stakeholder shared mental health needs are being factored in, and the mobile crisis unit is utilized as a resource more now than ever. So for counties that already had that in place, they were able to utilize it more. For counties that didn't have it in place, they experienced a very intense service gaps for these youth. The expanded use of and access to phone and video to replace in-person visits and in-person appointments removed barriers for families and removed office hour limitations for youth who were in need. And so these became very important in stabilizing youth in the community and actually offering more support. However, serious needs did exist. They don't go away because of a pandemic. One stakeholder shared that they saw more domestic complaints and person crimes as a result that did not rise to community safety threat when law enforcement agencies responded. They used a crisis line to respond to these needs in the absence of secure custody. So overall, more of a focus on needs and underlying factors, less use of secure custody for non-safety related referrals. So those were the themes that came up in the qualitative data. And that helped us move into a third phase of study through a partnership with the Follette School of Public Policy. They have a Capstone project and a team of students, with Genevieve was one of, focused on 5 counties, and we're able to do a review and assessment and interview process related to the use of fines and fees and community supervision, also known as probation, to see if there was a COVID-19 impact in those 2 areas. We chose those 2 areas, and the students chose those 2 areas because those are 2 policy areas that are directly related to increased racial disparities within the youth justice system. So at this point, I'll hand it over to Genevieve to share just the high-level areas that they saw COVID-19 impact specifically, and then we will continue on. So Genevieve, I'll hand it over to you.
Awesome, thanks so much. Yep, so as Anne said, myself and my team kind of created a companion report to these other youth justice findings. And I'll speak to our key takeaways as related to sort of community supervision primarily, but please do check out our report if you're interested to hear more about our fines and fees findings. And so we kind of, through our interviews, we spoke with staff across 5 counties in Wisconsin. We heard a few key takeaways. First, on the front end of the system, we heard that pandemic-driven shifts to virtual school really significantly reduced the use of law enforcement when addressing truancy issues. And this really highlighted a pre-existing over-reliance on law enforcement in the school setting, which very much complements some of the findings that Anne spoke to on the previous slide. And it also there was this theme of the shift to technology and what it meant for the youth experience in the youth justice system. Even though that technology use was happening in school. We also heard that for youth already involved in the youth justice system, staff noted that a shift to using virtual appointments, court hearings, and service provision really removed barriers to participation for both youth and their families. And that was to, help avoid some of the barriers that come through transportation needs, childcare needs, and work and school scheduling conflicts. And that didn't just increase participation and the voice and input of youth and their families, it also reduces the consequences for failing to attend and failing to participate in key youth justice events. And on a similar note, staff really noted the strengths of using various types of technology to connect and build relationships with youth, even outside of sort of required interactions. And I'd say perhaps the most powerful takeaway from our project was really well captured by a quote you may have noticed on the first slide of the PowerPoint. One county stakeholder said, "All it took was a deadly pandemic to get kids out of detention." And I think that really speaks to the importance of connecting youth to appropriate services in their community in more home-like supportive settings. And that's really what supervision can do compared to detention. And it really identified what it took to get supervision to become a more default option for youth. And I'll leave it there for now.
You're on mute, Anne.
I knew that was going to happen. Thank you. So notwithstanding the terrible conditions of the pandemic, the terrible consequences of the pandemic, looking at the youth justice system in this kind of time-lapsed, consolidated framework and severe set of conditions really lends urgency to the disproportionate impact for youth of color. This time-lapse look at how young people are referred and how they are responded to and then how they are supported really points to equity issues in terms of access and the use of alternatives for youth of color. It also points to service gaps, and it also points to the importance of collaboration and focusing on needs rather than consequences. And we really believe that moving forward, based on the qualitative data of what people are experiencing every day and what is well documented in data, that formalizing collaboration into policy and focusing on needs can reduce school, community, and probation referrals to reduce the use of secure custody as we move forward. And then this all kind of fits into an umbrella around increasing diversion away from the youth justice system and back into a community system of care and support. Again, the collaboration, identifying service gaps, which are well documented, whether they be geographic gaps or gaps in terms of effectiveness or a lack of culturally competent services, or age-appropriate services, looking to racial disparities as clues that something underlying needs to be addressed differently, and that supervision needs to be consistently a youth-centered and relationally focused practice rather than punishment. And that without doing that, it actually leads to greater disparities rather than lesser ones. So with that, I'll turn it over to Erica to invite our panelists to respond to these findings. They will probably affirm what a lot of the people in attendance are experiencing in their daily world. So a lot of pre-existing here that was really reaffirmed and intensified by the pandemic. So Erica?
Great. Thanks, Anne. Thanks for that wonderful summary. Yeah, so these are some big, hefty questions, but really we want to get the perspective of each of the panelists on what would it take to embed and formalize some of the things, the lessons learned around collaboration or communication or technology practices that were used in place of secure custody during the pandemic. I think this is apparently super relevant as we're allegedly coming out of a pandemic. And how do we keep what we have been doing as we're gonna attempt to go back to normal? So in addition to your perspective, what would it take to address the service gaps and the underlying factors that make diversion more equitable across racial groups and jurisdictions? So if folks could speak to that in order, and we decide to start with the county because the county is at the center of the systems and what's working. So Bridget.
All right, thank you so much. Before I dive into answering those really intense questions, I wanted to just take a minute to just describe my position, as it actually was designed to do many of the things we talked about today. So have an impact on our youth justice system. How do we reduce referrals and have an impact on our disproportionate minority contact issue that we know exists in our system? So the goal of system of care is to provide interventions and supports as a response to behaviors that in the past would have resulted in referrals or tickets. And much of the work that system of care does is actually really embedded in our schools and communities. So my lens might be a little bit different from others on this call, but I think it all connects really well. When the pandemic hit, it was really an amazing opportunity for us, and I hate to say that, to actually be able to formalize some of our collaboration that we were already kind of working towards. So we, just like many others, took advantage of this technology and came together as youth serving agencies along with our school partners and started to meet weekly to just really sort of like mobilize our efforts and how we were going to now wrap around our youth and families with school going virtual. So we got really innovative and partnered around finding large spaces and staffing those spaces so that we can almost be sort of like a drop-in place for a handful of youth at a time to stop, whether it was about just needing a connection, needing assistance with school, or picking up supplies. We also really came up with a plan and mobilized across our partners on coming up with a list of youth and families we were especially worried about. And no surprise to you, it was oftentimes within our communities of color who were needing us the most. And so really coming up with a plan to do kind of outside home visits so that we could lay eyes on our youth we were worried about. And then we became creative around offering some outdoor pop-up programming for kids because we knew that social emotional learning piece was going to be really important during this pandemic. And I'm really happy to say this collaboration has become really formalized. We continue to meet on a weekly basis via Zoom with all of our youth serving agencies in our local school district. And what's come out of that is additional partnering around staff training related to racial justice, related to family engagement, related to social emotional learning. And I think Anne talked about that we're seeing some really intense needs out of this pandemic. And so really pushing our youth serving agencies to create more social emotional learning opportunities within their programming that they've always provided, but really being intentional about that. Internally within Human Services, again, just like many other organizations across the country, we finally had the opportunity to invest in technology that we needed to do our jobs. I mean, I'm a county employee, but most of the social workers up until the pandemic did not have access to smartphones. So the county was actually able to invest in those, invested in other technology, allowed our staff to be flexible with their time, their schedules, being able to work from home, and gave them the tools they needed to do some of those virtual visits and sign paperwork electronically. And all of those practices remain in place. And I think the intention and really the vision of La Crosse County Human Services is to get people now out of their offices and be more flexible and be present in our community and to continue to allow that flexibility around some of that virtual interaction. We also took advantage of the reduced use of law enforcement during our virtual school. And we began looking at truancy very differently. And I'm excited to say that we ended up making a really significant system change we now have removed all of our truancy cases out of youth justice. So no longer is there any court involvement, and we reallocated resources to social workers, to system of care. So what this has done is created, again, more flexibility, more family engagement. The social workers who moved out of youth justice are already talking about their ability to see families more often. So even though we're considered early intervention, the work has actually become more intensive. So we're actually seeing just some great outcomes out of that work. And then lastly, at the same time that we're making these changes, our local law enforcement also decided to implement what they call a lightest touch policy around juvenile arrest. And so their intention eventually is to stop ticketing kids completely. So we meet with our law enforcement on a bi-weekly basis, and we problem solve around specific cases. How do we become creative, innovative in filling that service gap? Because we still know kids need interventions and supports in lieu of the punitive approaches. So again, have formalized those practices around communicating with our law enforcement. And then just to mention a few things around the building a more equitable system. I just thought it was really fascinating to acknowledge that at the same time that we were in a pandemic, we were also in this very justified racial unrest in our country. And so if there was anything positive that came out of this pandemic, it would be that no longer could we ignore the fact that there were significant racial inequities that existed across our systems. And so I think, people took advantage of the plethora of racial justice trainings and other virtual opportunities that arose around, how we better understand racial equity. And I think in order to continue to address this issue, I know, La Crosse County Human Services has made a significant investment, and all of our staff are now required to go through racial justice training. But I think that it takes more than training and good intention. And I think we are really pushing for racial equity to be part of every conversation in our work. So currently, working with partners to build some racial equity communities of practice so that we can bring people together to continue to educate ourselves and mobilize around issues that arise regarding racial equity. And then finally, lastly, during the pandemic, it was clear in our community that our Black community in particular was really suffering. I think disproportionately being affected by health issues and loss of loved ones, economic loss, safety issues. And so I know probably like many others, I took advantage of some COVID related grant funding and have begun to build up some of our community partners who are minority owned, whose mission is to really support and build up our communities of color, because we know that research shows that in order to be culturally responsive, we have to have more adults who look like the kids we serve across our system. So I have invested in community cultural liaisons to help support our Black families in particular. And again, I think that the outcomes are already demonstrating some tremendous success. So hopefully this happens across our systems. So with that, I'll pass it on to the next speaker. Thank you.
Thank you, Bridget. That was amazing. So much there. Alana.
Bridget, you're a tough act to follow.
Got a lot in there.
So first, I just want to acknowledge, a big step that we've made as a state towards making diversion more equitable is
we're currently wrapping up the 4th and final phase of statewide YASI implementation. For those who might not be familiar, the YASI is the Youth Assessment and Screening Instrument. It's a validated tool that considers a youth's risk to reoffend in the context of their areas of need and also, very importantly, their areas of strengths. So currently, as of December of 2021, COVID threw us some curveballs, but all 72 counties in Wisconsin are trained to use this tool during youth justice intake. So this is a systematic way for us to match youth with the most effective level and type of supervision and services if they're necessary. It's also a strategy for us to standardize our statewide data collection about the needs of youth who are referred to youth justice, which is important to help us ultimately guide state practice. In terms of service gaps, the Youth Justice Innovation Grants have been offered since 2017 as an opportunity for county human service agencies as a way for them to implement new creative or evidence-informed practices or programs with some short-term startup funding from DCF. Just thinking about some of the material that was presented this afternoon, we do have a school justice partnership project, and those projects have helped communities address truancy and school-based referrals outside of the youth justice system. I think a particularly salient example today is Racine County. They noticed that 2 schools in their district were responsible for most of the youth justice, school-based youth justice referrals in their community. So they're currently implementing a new project to increase school and community competency in those 2 schools to respond to and prevent student emotional and behavioral health crises in order to reduce referrals to youth justice. That project just started in October, and we have a check-in scheduled for this spring. So once we have more information on how that's going, I'm excited for us to be able to share that out with the rest of the state. Building off of something Bridget shared, following the events in Minneapolis and also just across the country in the summer of 2020, we decided to offer a new project area that's focused on racial and ethnic disparity reduction. So Eau Claire County is taking a close look at their data and also their county practices. Again, that project is in its infancy, but that's another project that we're excited to share out some of the lessons learned with the rest of the state as they continue to work through their innovation grant. The last thing I just want to mention, though, about the innovation grants is they're amazing. It's one of my favorite parts of my job to get to talk to counties about the new practices that they're putting in place. But the grants are competitive and they're time limited, so they're not widely available across Wisconsin. So I think, one of the questions on this slide is, what would it take? Funding? Yes, it would take funding. We continue to hear from our stakeholders that access to community-based services is a priority and that those resources are needed. The governor's last budget request included critical investments in services that unfortunately were not funded. That said, the next budget cycle is right around the corner. So, call to action, I would encourage you, connect with the stakeholders in your community, continue advocating for investments in necessary community-based services. It's really, really important.
Thank you so much. All right, Lance, you're up.
So Lance Horozewski, I work for the Wisconsin Department of Corrections, and the Department of Corrections really fills the deepest end of the system need for the youth justice system in Wisconsin, so which has oversight of secure detention, county-run secure detention facilities, and operation of our one secure correctional facility, but also oversight of aftercare services for the serious juvenile offender program, and we also operate a non-secure facility in the southern part of the state. So for us, really, we had to pivot significantly with, thankfully, a substantially reduced population in our secure correctional facilities, and then also transitioning youth back to the community on our community supervision. And our pivot to virtual visits, we were very quickly able to move towards virtual visits for all of our youth, both in facility and in the community, which allowed for substantially greater engagement with our youth and their families. It really, our community supervision workers saw much better gains in engagement without transportation barriers or system barriers that impedes a youth's ability to maybe do an office visit or meet our supervision workers in the community. Those visits were able to happen and those engagements were able to happen in the youth's home. That was a significant benefit for us, and it really broke down the barriers for the majority of the youth that we work with are in urban communities, which benefited the youth and the families. The second piece was technologically, we were able to move forward what's called a skills app. So a lot of our work revolves around increasing skills in our youth and helping them learn better coping skills, anger management skills, and engagement skills. So we were able to move forward technology that we can actually electronically send to youth. Our workers were able to role play and skill practice with youth live one-on-one without a youth ever having to leave their home, which was a huge benefit for our staff and youth. And it really broke down those barriers that often plague youth and families with system engagement. Those are the primary areas that we were able to use technology and fill those service gaps for our youth and be able to have our staff effectively engage with youth and their families. Really, the partnerships was with our local county partners and helping them problem solve some of the placement issues they were having with youth. So they didn't have to send them to juvenile corrections. We were able to staff cases on the front end, which has never been done before, to actually divert youth from juvenile correction programs. I have a county background. That's where the majority of my work has been done. So I could certainly relate to some of the challenges counties face with access to care. So we were able to partner and staff cases with counties to help them problem solve and to be able to, when youth were admitted to our facilities, break down the barriers to reunification back in their communities, whether that's helping make referrals, but also helping our staff engage with local services to be able to transition youth successfully back to their communities as safely and as quickly as possible.
Fantastic. Thank you, Lance, for all that. I have so many things to takeaways, but Sharlen, why don't you give us your perspective?
Yeah, absolutely. Thank you so much for this opportunity to just have this amazing conversation. It is definitely well needed. And I think just far overdue. I think so really quick, Sharlen Moore with Youth Justice Milwaukee and Urban Underground. For those that are not familiar, Urban Underground is a youth leadership and social justice organization that works with high school age young people here in Milwaukee. And a big part of our work is through Youth Justice Milwaukee, which is a coalition of impacted young people and supported community members to really look at closing down our youth prisons, which we've been working on for the last several years. One thing that I really love about the report is that it just highlights the inequities. It highlights the things that we already know that really have just come to the forefront. You know, so when Ann started out with that slide about a 65% decline in referrals, that tells you something, right? Like, you know, when I saw it, I was like, why weren't we doing that before? Right? Because, you know, we've gotten into this sort of system where this is just how we've done things. And COVID was that gift and that curse that really removed the layers of the inequities that not only have been going on in Wisconsin, but just around the country. So as we saw how counties have decided to do things differently, or even, I'll use the word, were forced to do things differently based on the pandemic, we come to realize that, wow, things can be done very differently. And I think Bridget said it well when I thought about, just some of the things to share. It's nothing new. We have to look at things that are innovative, and we have to be creative when it comes to our youth justice system. And I should say our youth legal system, because when we talk about and put the lens of inequity, when we look at the disparities, even though numbers have gone down, unfortunately, we still see Black and brown kids that are still being impacted by the system. I love that we've been able to use technology and be able to engage the family more, but we really have to take it a step further and really drill down on policies and looking at it from a racial equity lens, so that we can say, you know what, COVID, not COVID, 2020, 2025, like we really have to say what is going to make the deeper impacts. And that's, drilling down on the policies, looking at how we look at youth incarceration. The folks on here know that, for the average person, you all, we know that young people are impacted by poverty. They're impacted by racial equity and racial justice. But when we talk about how do we best support young people and their families, we really had a great conversation last night, because Milwaukee County has about $400,000 that they want the community to decide how to spend to support young people in Milwaukee County, and really looking at our most hard to reach young people. And we had such a beautiful conversation last night, and where we talked about how do we support young people's mental health? How do we support their family? How do we look at meeting them where they are? A lot of what we're talking about, folks, is how do we spend resources more effectively? How do we currently right now, for those that don't know, I think we're looking at about a little bit over $1,100 for a daily rate. In about 2020, I think we were looking at about $550 a day. Now we're more than double that. We're over $1,100 a day. We're looking at over $400,000 to incarcerate, not 5, not 10, one young person. So when we look at that, and it's astounding, because when we look at youth incarceration over the last 10 years, the numbers have significantly declined. We have about 50 young people, roughly, about 50 young people currently at Lincoln Hills and Copper Lake. As the state continues to figure out how to close the facility, the numbers, as we become creative and innovative, the numbers will continue to slowly decline. This doesn't mean that the budget slowly declines. The budget actually goes up, because with less young people, we have to adjust the rate to still adequately have the appropriate number of staff and services that the young people still need. So a big part of our work as advocates is to say, we have to do different. We're still fighting for, and I have to say, it was really tough for me to go to the hearing last week to talk about, allocating $40+ million to the Department of Corrections to build another Type 1 facility. That was really tough for me, because $40 million for a 32-bed facility is a lot of money. Do we want to see Lincoln Hills relocated to Milwaukee? Absolutely. We absolutely do. And we know that we are not at the point where we can talk about not having locked spaces. Those are things that we're working towards. So we're hoping that we're able to provide more evidence-based and more practical, humane spaces for young people that can focus on their mental health and focus on, again, the things that the report highlight, the things that young people need. Counties were, did, such a better job in supporting young people and having them get referred to things that they really, really need. We have to continue those efforts, and we have to continue to highlight the need to say, how do we do things better? How do we look at young people? How do we keep those youth that are 17, 18, 19? We're not even there yet when we talk about adolescent and their brain development and keeping young people in our youth justice system. It's still a fight, but I'm so honored to be in this space with individuals that understand that we have to do better.
Thank you, Sharlen. Thank you so much for that. You summarized so much of it already. So we have a few minutes left when so much robust conversation to be had in the future, but I'll pass it over to you, Jen, and then Josh, you close it out quickly with a national perspective, a few minutes, and then we'll conclude and go from there. So go for it.
Thank you. Again, another tough contribution to follow. There's been so many great points made today. Really, the second question on that questions slide stood out to me. And really what it made me think back to was a previous Kids Forward report that described the youth justice system as a complex maze. And really thinking back to the work that my team did on community supervision can be a part of a smoother, more supportive route out of that complex maze. But, a lot needs to go into that. It is not inherently that kind of exit. And what did the pandemic sort of teach us about this, especially in terms of equity and racial equity? And really what it makes me think of is that there are sort of two types of diversion that community supervision can play a role in. That is diverting youth out of detention and back into their community, but still under supervision. And then there's that second level of then exiting supervision into an unsupervised, unsystem involved life. And for community supervision to sort of be sort of an important, healing, equitable route out of that complex justice maze, I think that, policymakers, practitioners need to examine sort of some of their data and say, who is being diverted out of community, out of detention into community justice, into that more home-like setting, who is being kept in the system longer under some sort of this sort of gray area of just prolonged supervision when they could be fully exiting the system and sort of being able to get their life back on track. And you have to ask those questions in terms of racial disparities because they'll look different in a lot of communities.
Fantastic, amazing points. Thank you, Jen, so much for your contribution. And Josh?
Yeah, thanks. So I'm Josh Rovner. I'm with the Sentencing Project in Washington, D.C. We support effective and humane responses to crime. And that's true whether crime is going up or going down. The data here are very clear that, we were in retreat during the early months of the pandemic, whether that's because kids were just getting into less trouble or it's a lot harder to shoplift when all the stores are closed. Whatever it is, we know what works for kids and the harsh responses don't work. I think what we can take out of this report is the hopes for a new normal of creativity and flexibility. We heard about the use of phone and video as adequate substitutes or better alternatives. I mean, we wouldn't be meeting here if not for Zoom. Removing truancy cases out of juvenile court entirely, the lightest touch from law enforcement. These are things we all could have been doing all along, right? Like, this is not rocket science. We understand this is better, that we were all teenagers and screwed up ourselves and knew then, as we know now, that we didn't really respond all that well to the harshest punishments. So what I really like hearing today is how these are creative responses that did not require state laws. There's no shortage of state laws that we need. Wisconsin is really standing practically on an island with Texas and Georgia, pretending that your 17-year-olds are adults when they get arrested. They aren't. You don't let them vote, you don't let them buy beer. They're not adults, but we talk about charging them as if they are. I think that's something that can change. But what we heard today is the ability to use creative solutions and flexibility to implement changes that don't require laws. Now, this is plainly a tough time for all of us. The virus itself doesn't care about your zip code or the color of your skin, which isn't to say that the impact has been equal. But I think that the reason that these solutions that we've heard today have worked is because we've tried to figure out how to respond to an unusual time. And as much as I would love to see a lot of this formalized, what I would really like to see formalized is the idea that, like, when problems come up, that you don't need to wait for a solution from above or a state law. You know, I mean, Sharlen was sharing money of how much it costs to actually run these programs. If it actually worked, if Lincoln Hills was a successful program, then sure, $400,000 a year, sign me up. But it doesn't work. It's a failed policy. So why are we putting money after programs that we know don't work? And I hope that's one of the things that we can take out of this conversation, is that we ought to be doing things that make our kids better off, make our families better off, and make our communities better off. And I think that's what I'm hearing a lot of today.
Wow, fantastic. Everyone just so unbelievably grateful for all the contributions. And I think everybody really brought their special sauce of perspective and contributions. And I do think that, you know, this is the beginning. And we have a lot of folks in this webinar and as allies alongside in looking to how to permanently make a better system for kids, and families and communities, which is what Josh just said. And we sincerely hope that we can continue this discussion and even get a little bit more in depth on each one of the sort of points that the panelists made in the future, and do so together. So yes to innovation, yes to flexibility, yes to targeting when it's needed. A targeted approach is not also, you know, I thought that was something that really came out of the Crosse, right? Like, you know who the families are, you know who the kids are, you know, so let's focus there. And investment and funding, it matters for sure, right? So thank you all. I think that Anne put a bunch of stuff in the chat. We did not have time to answer everyone's questions because we only have like 2 minutes. I know there were 2 in there. Now they're somehow maybe disappeared, but reach out to us and we will try to answer them for you and in the future. And so,
hey, Erica?
Yes.
No, can I just say really quick for those, just really briefly, for those that are on and are listening, there are folks that are in so many different realms, whether you work directly in the system, whether you're an advocate, wherever you are, please use the data, please, the reports that were shared, please use this information, because we have to all collectively, I'm on the outside looking in, and I'm just like, okay, look, I know this isn't good, but I'm doing my part. We all have to do our part. So if you are, particularly those that are working within the system, please share it with your staff, share it with your supervisors, you know, push the envelope, right? Ask the really tough and challenging questions. Nothing is going to change if nothing changes. And it really, really depends on all of us to do our part.
Thanks, Sharlen. So yes, there's a survey, there's the reports that are in the chat. Thank you all for coming. Thank you to my colleagues who made this possible and did the tech part. And yes to all of you continuing to do the hard work to make change. And we will see you again, I hope, soon. So thank you. Have a wonderful weekend. Thank you, Anne, too. Thanks, everyone. Take care. Be safe.